Yes. So hide. Yeah. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we are conducting speaking sessions and here we have with us Bakir from Ontario, Canada, originally from Baghdad, Iraq. This is a speaking role play session number 1, official authentic study material. These are the daily
Thank
dosage profession specific speaking materials and medicine profession specific speaking tasks. Sorry. Yeah. So you can start now.
Hi, I'm Dr. Bakir. I'm the physician on duty here today. Can you confirm for me your name and age, please?
Yeah, my name is Abraham Lincoln and I'm 45 years old.
Okay, Abraham Lincoln, how would you like me to address you?
You can call me Mr. Lincoln.
Mr. Lincoln. Okay, Mr. Lincoln, what brought you up here to the clinic, please?
Actually, 2 weeks ago, I had a mild heart attack and I have been recovering from that now. And I was discharged 4 days ago. And I'm seeing you, doctor, because I'm not sure how much physical activity is appropriate for me.
I'm sorry for you that you have suffered this heart attack. It must be very difficult for you. Well, I just want to reassure you that uh, after a mild heart attack, definitely you will experience some forms of fatigue and tiredness, and maybe even sometimes you will have certain forms of anxieties regarding your future health. But I recommend and I advise you, in fact, that after the heart attack, you should go back to, to your lifestyle gradually. You should adhere to your medication. I advise you to adhere to your medications and the importance of uh, following up a healthy diet.
Right, doctor, that's very fine. But let me tell you some recent developments. I have felt much weaker and very tired since the heart attack. I'm worried that any physical activity, such as walking or gardening or swimming, might bring out another heart attack. So I'm a little bit worried, doctor.
I want to reassure you that this fatigue and tiredness that you are having now, this is all accepted or expected, and it will recover within, like, you will need around 4 to 6 weeks to return to full life or to return to your previous life. So it's needed at the time being to have as much as rest as you can, and slowly, slowly you will return back to your usual life and do the exercises that you like to do.
Right. I'd like to know how much physical activity is advisable. You have suggested me. That's very fine. But let me tell you, I'm an office worker and I sit at a desk all day. I don't get much exercise at work. So, in this case, what are your recommendations?
So I recommend to you after the 4 to 6 weeks uh, after the heart attack, you will need to have moderate exercises, moderate physical activity, because this will slowly, slowly will help your heart to get back to normal, and you will feel stronger. Um, as uh, as you said that you most of the time sit because your job uh, type is like this. So you have to return to work like after 6 weeks. No need to rush back because all this anxieties and all these uh, pains that you had, it needs time for it to heal.
Yeah. I want to ask you, actually, because of my worry. I'm worried about having another heart attack. So I'd like to know what I can do to reduce the risk of further attacks.
Okay, first thing first, as I told you, after 4 to 6 weeks recovery, okay, you will need to join cardiac rehabilitation centers. Okay, plus you will okay, you need to take a diet that is rich in vegetables, whole grains, and to stay physically active. And of course, if you were a smoker, you need cessation of smoking and increase amount of oral fluid intake.
Yeah, that's a very good idea. And the information has been very helpful. Is there anything else that I need to know, doctor?
No driving for 1 month after the heart attack.
Okay, thank you very much. I'll try to gradually do more exercise and I'll look into the rehabilitation program. Thank you very much, doctor.
Thank you.
Right. So that's fine. Yeah. To tell you very clearly, you're doing excellently well. There is no problem at all. You're comfortable, relax, cool, patient. Just to do starting. Let us think that it is zero. Okay. You're not even 50 like that one out of 500. Think that we are starting from zero. So do everything fresh. No problem. Actually, you're doing very well. Yeah, it deserves more than 350, definitely. You're working well, and the way how you're presenting is very nice. So I will get the script of this audio. I'll get it, and then afterwards, I'll come out with the corrections, suggestions, and improvements. Find
Thank
out the
you.
mistakes. I'll find first I'll get it typed. Then afterwards I'll put it forward and I'll call you and I'll show you these are your mistakes. These are your mistakes. So I'll put it in the scripted form, in the dialogue form. Then afterwards I'll evaluate. First I'll give you your identify your mistakes. How many mistakes are there? Underline and give you. The next one, these mistakes will be marked red. And then
Okay.
next one there will be marked blue. That is the correct version. Wrong version red, correct version blue.
Okay.
Okay, and improvements I'll give you other than this. So I'll give you new sentences, how to what is the improved version of the speaking test, how can you improve your speaking to get at least a 400, not don't target 350, target 400, so you can try your level best. Is that
Okay.
clear?
It's clear, sir.
Do you
Thank
have
you.
any doubts?
I'm just worried.
Okay, fine, no problem.